Hello, everyone. Hope everyone's safe and healthy and having a good evening. I know we had a great day of weather here on campus today. Still gorgeous outside, blue skies. Our first taste of spring and summer here in Ashburnham. I hope you're all doing as well as can be during these times, and I'm excited to have this conversation with you tonight. Wanted to give a few minutes. Our participants are still ramping up at this time. I know everybody's probably going from one Zoom or one meeting to the next in a lot of ways. So we've just crossed the over 150 mark, and I want to give the opportunity for everybody who registered to come on board. While we're doing that, I'll just give a little overview of what we're going to talk about tonight. I'm going to give a presentation. I shared my screen with you already, which I'll go into in just a few moments. And then, similar to the webinars we've had in the past, if you're a returning family and if you're a new family, if you've been on these before, let's use the chat feature to ask questions. You can put the questions in the chat feature. I will take a look at those, answer those as I can, and we'll try to be as efficient as possible. We're also going to keep track of that log and share, hoping to develop a Q&A as time goes on, and we'll put that up on our website if we don't get to all of your questions. But even if we don't answer them tonight, we'll make sure we'll get them out to you in the quickest way possible, and be sure that you have all the information that you need. So let's still have a few coming in. Let's give it maybe a few more seconds, and we'll get going. Wanted to get together tonight. I know we've all done lots of work over the last few weeks from home, and certainly Cushing is no different. If you're a returning family, you've been with us for making the shift to remote learning, which I think has gone remarkably well. Coincidentally, today was our last day of synchronous classes, so that's a celebration. Some of your penguins are at home celebrating their last class and transitioning. I know in my house from sophomore to junior, junior to senior, and soon to be an incoming freshman. So that's exciting in many ways. And some of our new families are looking towards the new school year with excitement. So I thought to give you some information. You're probably all wondering not only how we've handled the current coronavirus pandemic here on campus, and have heard about our online, certainly for new families, heard about our online programming and the way that we're looking at that, but really wanted to focus both for new and returning families tonight on our work towards the fall and what we're doing there. A few weeks ago, we really looked at forward-facing, focusing most of our energy, time on the fall, what that would look like, in all the many ways that we could prepare for what the reality is at that time, which we're not sure of. Right? It's a very uncertain future, unprecedented time, lots of ambiguity, which is difficult, but we have to plan for all scenarios. So we did assemble what we're calling a Bring the Penguins Home task force with the sole purpose of telling us how we're going to open in the fall. So we have made the commitment that we are going to be open. It's not a question of if, but how. Within state, federal, local guidelines, following best practice recommendations from CDC and other sources, which I'll get into in a little bit. And as we looked at what this task force would look like, I really wanted to bring together an all-star team, a group of people with expertise, not just in-house expertise, but also varying perspectives, not only in the medical field, but in the boarding school world and in our operations, all the different operations we do on campus, and the expertise that someone could bring there. So the idea was to really create a team of professionals who are experienced in a variety of areas to deliver on our mission, right? Exist for students and come together and create a plan where they could come safely in the fall. So I want to talk a little bit about that tonight and some of the work that we've already begun and what we're looking forward to do. And then I'll give you a chance to ask your questions as we progress. So when we spoke about our team and about medical expertise, we also thought that as we look at developing this group, as we look at what we need to do to implement the best practices and recommendations of CDC, medical expertise, and all the varying guidelines about what the future unknown reality is going to mean, we really thought that we need an operations expert, someone who can take all of the varying recommendations and put them into our day-to-day work at Cushing, from food service, transportation, athletics, academics, student affairs, dorms, so many different areas that really need operations plan. And we thought we needed some help with that. So we working with Ox, which is a operations specialist consulting firm. And Bill Rouse, senior advisor, is on our steering committee, and really project managing this for us, along with our senior team. Paul Silva, CFO, Catherine Pollock, associate head of school for enrollment, myself, along with Bill, are driving this process. And we brought in some expertise, who I'll talk about in a minute. A member of the Ox team, Dr. Adriana Bravo. She's a boarding school medical director at a boarding school in the DC area. They've begun this plan, and I thought it was important to have that other perspective, from another school that's begun this work as well. Adriana, from Dartmouth area, Dartmouth College, Dartmouth School of Medicine, residency at Johns Hopkins, has the background in boarding schools, has been a boarding school MD, and that's her sole focus at another school before her current school in the DC area. So I thought that was some really great perspective from the outside to join with our current health center staff, Sue Casey, and our medical director, Dr. Michael Muchler. So lots of expertise there, both in-house and then in the boarding school world as well, to bounce ideas and talk about how we're all approaching this challenge. And then in addition to that, we've added Dr. Christina Hermos to our team, and she is affiliated with UMass Medical School's associate professor there, and her specialty is in pediatric immunology and infectious disease. And she's joined our team. She's solely focused on Cushing, is not working with anyone else, part of our steering committee, and already a great resource for us. And then rounding us out in terms of our medical expertise, Dr. Ann Hohen. She's Associate Professor of Epidemiology and Biomedical Science at Dartmouth School of Medicine, and is on the task force at Dartmouth for the reopening of their campus as well. So another perspective, right? Another area, university, epidemiology, public health, biostats, someone else who could really round out our team with another subset of expertise, and also from the university perspective. So wanted to have many different approaches, many different ideas and ways to come at what we're looking at in terms of this challenge and how to open safely. So with Ann's work with Dartmouth and medical and opening there, her background as an epidemiologist. Dr. Christina Hermos, she's at UMass, working with pediatrics and specialized in this area. And then our operations group to bring it all together, project manage this along with our own senior team in order to indeed bring the penguins home in the best way possible. And I know I highlighted this at a high level on our website, which I sent in a letter about a week ago, inviting you to the webinar tonight, but thought it was important to highlight the members of that group and what they bring to the table and how we hope to work with them through the course of this in order to achieve, like I said at the beginning, not if, but how we're going to open in the fall. And then after that, we've developed some subgroups who are already working the student experience, which houses academics, athletics, student affairs, residential life, extracurriculars, admissions, some of that orientation, new and returning families, and then of course campus operations and business continuity, everything that falls under there, which is another really broad scope of what we do here at school. Health and wellness, again, going to be especially important. Very important always, but especially important during this time, and making sure that Sue Casey, our Director of Health Services here on campus, Michael Muchler, are working with our team and constantly going up to the senior team and back. Dr. Muchler is also on our senior steering team as well, to be sure that we're able to adjust and change. And the news changes all the time, and what we know today will probably be different than we know next week or a month or 2 months or when we open from now. And we want to make sure that our plan is flexible and allows for best practices and updates to our approach. And then lastly, communications. This will be the first of a series of talks we do every couple of weeks to update you, to talk about our work. I think that'll be important as we approach particularly the opening of school. So I'll update you at the end when we're going to do this next. But of course, all of our returning families, certainly many of you have my, you all have my email, but many of you have my personal cell. You have my, if you're international, my WhatsApp, or from mainland China, my WeChat. I want to hear from you. Don't think that it's too much or you're catching me at a busy time. I know this is a priority and something that is one of the things that you're probably thinking about quite a bit. So I want to make sure that either I or someone on our team communicates with you to get you the most up-to-date information that we have. And we will be sending it to you as well. But if it's something that you're anxious about or worried about or want to chat about, don't worry about it. Just get it to us and we'll tell you if we know or not. And we want to make sure that we have that two-way partnership. If you're a current family, one of the things I always talk about is having that two-way communication, and that's the best approach that we can have to support your child. And for new families, we want to begin that in an unusual way with COVID, but certainly that's our approach typically, and want to start that here as we roll out the Bring the Penguins Home task force and the work that group is doing. And this is in conjunction with the Massachusetts reopening phases. So we did look at where we were there, which just moved from that stay at home to the start. And so we're looking at guidelines from the state of Massachusetts. We're looking at the reopening phases, following those, making sure we're following guidelines, being in touch with our local Board of Health and resources here, utilizing our alumni and parent body to be in touch with other resources as needed. We also are looking at a dashboard of public health indicators. So Massachusetts Department of Public Health started this dashboard last Monday, looking at trends of, positive tests, 3-day average of patients in hospitals, number of hospital surge capacity. So all of that's trending in a positive direction. And that's another metric that we will continue to look at, not only for the state of Massachusetts, but especially in our area. And our steering team certainly has the medical expertise to know how to use this, not only for our state, but for our region, for our local area, and implement it into our plans and maybe increase or decrease our approach with the reopening phases and the public health data as recommended. Another thing we've been doing throughout probably the last 6 weeks is we've been talking with schools around the world. One of the unique circumstances of this challenge is that every school in every country is facing it, and some of those schools are now returning to school. I had a long conversation over a week ago with the executive director of the Australian Boarding Schools Association. They're going back to school, and all of the things that Australian boarding schools are doing to mitigate viral spread, to talk about what happens if a child is tested positive. What are all the policies and procedures around cleaning and everything else that we've been thinking about and planning and looking at. I thought it would be really good to speak with schools who are experiencing this in real time, who are coming back to school and managing this process. And we are still in touch with the director, Richard Stokes, of the Australian Boarding Schools Association. He's put me in touch with a few heads of school there. So that will be a continuing conversation. We're continuing to use TABS, which is the Association of Boarding Schools. They've been a great resource in this process. Not only are they doing webinars and education, but they're putting us in touch with experts in a variety of fields. And so that will continue. I've also had conversations with school heads in Germany, a big one in Denmark. Both of those have come back to school recently, and some of the actions that they're taking. I was on a conference call the other night with a head of school in China, boarding school that they're reopening, and the phased reopening that they're doing, how school arrival happened, and all the different pieces that go along with that. So trying to get a variety, like I said, with our steering committee, a variety of perspectives and ideas, and taking the best ones for Cushing and running it by our medical staff and ultimately through our operations to see what works for our community. But right now we're in that phase of trying to gather as much information possible to create the best plan to support the healthy return of our students in the fall. And that includes, federal government guidelines. The CDC put out something for schools last week, which, at this time is just a one-pager. So, of course, we're familiar with it. It's a part of our thinking, but we're waiting for further guidance. In the meantime, though, we're looking at their guidance for U.S. higher ed, which we can, certainly apply to our environment here. So we're looking at some of the new recommendations, changes, some of the questions and answers that they have. And then recently, just this week, put out a new report, which is quite lengthy, and going through that as well, seeing if there are other pieces that we can take from these recommendations, put them into our plan to exceed minimum guidelines, right? We don't want to do the minimum. We want to exceed in every area we can to make it the best and smoothest operation possible for when students are back here in the fall. And before Massachusetts came out with their reopening plan, we were already digging into others, Wisconsin, Rhode Island, and you see they all kind of had, their own theme for the state, which was kind of interesting with Rhode Island with the nautical theme and all the varying ones there, Pennsylvania, Montana, California. Just learning as much as we could about how states were approaching this, because at the time we didn't know how Massachusetts would approach this, and so wanted to again learn as much as possible about the thinking of state governments and how that would occur. Massachusetts, pretty similar to the others in phases, with certain businesses opening at different times, depending on the public health situation. So again, familiarity, especially with the Massachusetts plan. But before that was announced, our group, our senior leadership, and particularly the steering committee, was also examining plans from around the U.S. And all of that really, when we're looking at, again, our goal of opening in the fall, one of the other pieces that quickly happens after the opening is maintaining a healthy campus, making sure that not only do we prevent any viral infection or spread, but that we remain that way, that we're open and we remain that way. And that's a pretty serious task, and a challenging one, but certainly an achievable one. We've seen universities announce that they are going to do this in the fall, and I think that in comparison, we have a school of about 400 students, high school students, that we can control the flow of where those students are going in a much more contained way as compared to Notre Dame University, who just announced they'd be open, or where you have thousands of students all over campus, leaving campus, departing. Cushing is a much more contained environment, so we're very optimistic because of that. And now looking at, okay, if we can create that environment, how do we work to maintain that healthy campus? And so the way we're approaching it is, school typically, if you think about it, compared to a light switch, right? We're either in school or not. Students are on campus or they're not, and everything's happening as it would if they're here. And when students are gone, it's a pretty quiet place, as those of us who live on campus can talk about. The way we're approaching it is more of a dimmer switch, right? We can adjust the variations of how we're open, and a plan within all the different levels of where that dimmer switch can go. And it really provides us the flexibility that I was talking about earlier. How can we be flexible in our operations across all of our departments to adjust as needed, depending on not only the public health environment, but what's going on campus? And so that's really the approach that we're taking when we're looking at all the plans, that are possible, all the various scenarios that we can face in the fall. How are they flexible? How can they be adjusted? How can they best support our student body when they come back? And we're also looking, right, we want to react to local conditions as well, which is why we're always looking at those biostats that I mentioned before. So when we're looking at the switch that I spoke about going up and down, these are the areas that we picked out where, okay, if we're looking at everything that happens here on a daily basis, and this task force is categorizing those and breaking them into subgroups, what are the ones that we really need to focus on? And it's a big list. A lot happens here on a daily basis. But our Bring the Penguins Home task force has looked at the varying areas, risk, facility zoning, physical distancing, program modification, facility management. How did modifications happen there? Transportation, food service, the way we serve food, what time food happens, employee expectations, screening, screening on initial arrival, then is there daily screening? Is there a screening at other certain times? Is there personal screening at home for several days before you even come to campus? All of these things we're working through as options. And as we hone down our plan in reaction to the flexibility that we have to the public health situation, we'll be able to give you that news more and more. But again, that's one example where lots of flexibility within our screening process of how and what we need to do. But again, we want to exceed those minimum expectations that are placed on us as much as we can by federal, state, and local authorities. Personal protection, PPE, another one that's just amazing. When we announced, sadly, to the class of 2020 that we would be virtually online in the spring, we did it by video, thought it would be a little bit more personal. And at the end, somebody on our senior leadership team had coined the phrase before that, "We are Cushing." So I said that at the end. We're in this together. We're a community. We are Cushing. And several of our international parents, particularly those from China, just started sending personal protection equipment unsolicited. We donated almost 10,000 masks from our parents to Henry Haywood Hospital during that time. We donated another over 2,000 to Ashburnham local police, fire, and ambulance services. We distributed them to every resident here on campus and any employee who requested. We gave them to some businesses in town. And we also have over 22,000 here on campus that we have ready for the fall and ready for arrival. But, it doesn't stop there, right? But there might be other personal protection equipment, gloves, whatever is recommended that we need to do as well. So something we've been thinking about for a long time as we look towards the fall, and something that we'll continue to think about when we think about acquisition of materials and supplies. What do we need for the fall? Cleaning, PPE, other things. So that kind of goes into some of the other categories: health and hygiene, hand washing, hand sanitizer, cleaning, disinfection, high touch surfaces. Again, policy and procedures that I mentioned. How does all of this fit into an operating manual that we can train our staff, which is the next one, be ready for and get going in the fall in a way that supports students here, probably in the best way they could be supported anywhere, right? Because there's been such a thorough plan and examination and background about all these different areas, guided by some great medical expertise who are advising boarding schools, who are advising the reopening of colleges, who work in boarding school world with Ox doing operations, and Dr. Ermos, who's doing infectious disease in real time in pediatrics at UMass Medical, and also our own health center staff. Dr. Muchler, who's been Cushing Medical Director since 1996, and Sue Casey, who's been here over 20 years, coming together. It's a really nice team to be able to do that training, not only for the health side, but also to help for our entire community of students, faculty, and staff. Of course, financial implications. What does this all mean? What does it cost? How do we make sure that we're continuing to be responsible for the school and our fiduciary responsibilities here as leaders of the school? So we're working on that. And then, as I said before, communication. We want to be transparent. We want to make sure that we're getting information to you in as much real time as possible, and that we're able to communicate what we know, and just know that we have to have that flexibility and planning for what the public health situation dictates. And knock on wood, that continues to trend positively. But we are preparing for many different outcomes, many different layers of protection on campus, and working hard to do so. And of course, as I said before, but I think it's worth repeating, in touch with federal agencies as we continue to monitor what the CDC puts out, other agencies of the federal government, State Department of Education, Department of Health, our local Board of Health here. Part of our team is dedicated to monitoring federal, state, and local guidelines, being able to respond to those, fanning those out to the different subgroups, so the chairs have that information as soon as possible. I can review it, our senior steering team can review it, and it can be funneled to our ultimate operations manual. So again, a big part of what we need to do, as I said, we want to be leaders in this area. We want to exceed minimum standards. We want to create the best standard of care that we can. And we feel like that really the baseline for that is federal, state, and local guidelines. And then all of the things we've been reading about, that I'm sure many of you, I won't spend too much time on, but, mitigation, which starts with PPE, but could be, training on coughing, sneezing, for example, hand washing, a lot of the different practices that we can employ to mitigate viral spread, dedensification, social distancing. Maybe there's some like that, what I spoke about before at lunch, changing the way that that's scheduled, eliminating large gatherings as much as possible. All of the ways that we can do that, that's a focus. Of course, testing, which is another reason why the medical expertise is an important part of our team. We've also developed a really nice relationship with the CEO of Henry Haywood Hospital, which is in the UMass system, only about 10 minutes here from campus. So that's another way that we can have hopefully access to testing as we continue this process. Both COVID testing, antibody testing. They're also talking about pool testing, different ways to be sure that we're monitoring the health of our community, on arrival, and then, as I said, maintaining that healthy campus. And then screening. I spoke a little bit earlier about that, talking about maybe screening even before arrival, during arrival, and then even post into the day-to-day practices. At least while the public health situation warrants. How are we going to do that? What does it entail? What's the process? Do we need to be trained? How do we make sure that there's 100% buy-in and compliance? All of those pieces need to be worked out. But again, another area that we're focusing on. And the last one is contact tracing. How do we make sure we have really good contact tracing, both using 21st century, but also time proven methods, both of those. The Australian boarding schools had some really interesting ways of mitigation and contact tracing. And so, again, learning from practices, learning from schools as they do this in real time, and also from our own medical expertise, looking at guidance from state, local, federal government, putting that all together, coming up with the best plan possible. So again, it funnels through that same process, which I think is worth repeating. And I think it's important to talk about the advantages of Cushing here, and I hinted to that a little bit before when I spoke about the announcement that universities are making. When I said Notre Dame, they were announcing you have thousands of kids on a campus. They're adults. They're coming and going. There's not a lot of really control over. You can do some practices of de-densification and things like that, but I really think that Cushing, even in comparison to a lot of other boarding schools, has significant advantages as we approach this challenge for a number of reasons. And I'll share just a few of those with you. The first is that if the success of our remote learning is any hint for what's to come for the future, I'm really excited about the success of this, the Bring the Penguins Home task force as well. Our adults, our faculty, in short order, really was able to talk about being flexible, adjust, pivot, come up with a really unique program when a lot of schools were going with pass fail, with maybe programs that didn't contain or maintain, the academic integrity that we had. I felt like we really rose to the challenge and did that. We finished today 7 weeks of online classes. We were able to survey our parents. We were able to survey our students, and at high levels of not only participation in the surveys, but also high levels of satisfaction in that. So very excited with how that went, and now we're ready for the next challenge. The other thing about Cushing is we've built a lot of buildings in the last 4 years, expansive new facilities. Upwards over between $75 and $85 million in new facilities. So we have state-of-the-art facilities, state-of-the-art dining facility, which allows us to do some of the dining mitigation that we spoke about, some of the practices that we will need to do to limit viral spread. We're isolated, right? And we're in a small town in Ashburnham, away from COVID hotspots, which sometimes isn't a great thing, but in the COVID environment, it's a great thing. We're excited that we are a little bit isolated, and we can create hopefully a little bit of a bubble here in our community. As always, small class size, right? We have classes of 4 or 5 up into the high teens, and we could even strategize in ways to reduce that. So certainly that's another part of our work, and something we're certainly capable as we go through this process. We're one of the few boarding schools that has over 90% boarding students. So talking about arrival being a key time, and then maintaining a healthy community with not a lot of coming and going, gives us a real advantage. And when you look at that other 10%, right? So you say, okay, 90% boarding, 10% day. Half of those day students live on campus because they're faculty children. So we really have a small number of students coming and going. 90% of our faculty live on campus. Again, similar. We can really limit coming and going and create policies and procedures for how people come and go. We continue to have strong enrollment, which is a great testament, especially during this time. Last year was a record year for us. We're tracking very similar to where we were last year in terms of total enrollment. Which goes to some of our new families. You'll be hearing from us much earlier in the process. We want to engage our new families as early as we can, our graduation, which I'll talk about in a minute, is May 30th. And, once we get that and the year behind us, expect communication to be coming from us, not just in the forms and everything else, but we want to try to get you to meet students, your advisor. We'll probably do one of these communications specifically for new families, just ways to engage and become involved in the community even earlier, which we're even more excited about. And it is a nice benefit of going through this process, is really engaging our families in a meaningful way, much more earlier than we typically would have. And then I would say, from our perspective, certainly I think we're a leader in COVID communication. COVID was on our administrative agenda the week of January 21st. We put our first communication out to families January 25th. We did weekly, which you can see on our coronavirus page, communications to families almost right up until April. Got online learning going, began this process of bringing the penguins home. A lot of background work happened in planning, looking at scenario planning, how this would all go, and ways that this task force can fit into the various outcomes that we're looking at with public health. And certainly as we've gotten closer to the fall, we're seeing positive progress in our work to be able to get there. But I feel like we were a leader in that area, and our goal is to continue to have the best steering committee team with the various perspectives, whether it's medical expertise, supporting school, medical background, as I spoke about before, and continue to be the first to communicate this kind of plan among our competitor schools. Something we're proud of, and something we really have the goal of continuing. Again, Cushing's mission is to exist for students, and we want to make sure that's our focus, and that we're able to do that to provide the best experience that we possibly can when we open this fall. So with that, I'll just give you a little sense of our timeline going forward. So we initially, after a lot of background work, formed our task force. Took a little while to divvy out what it was going to look like, outline, establish goals, get our final members on board. And that was that operations, right? We were looking at, okay, we have medical expertise, but how do we bring this all together in a way that can create operating manuals for the various departments? And really for us at our senior team, an operations person was the way to go. And I'm glad we did. That was the right call. Already seeing some great organization of work come out of that group in a relatively short period of time. Our virtual commencement, Saturday, May 30th. So next week is our senior week, where all of our traditional ceremonies would happen virtually, trying to make it the best experience we possibly can for the class of 2020, with our capping ceremony and other various ceremonies that we have. We have a senior walkway with bricks where all the seniors' names are written, and that's already been placed. And I know I've sent pictures to my advisees with their brick, and so that's something special that we'll plan on sharing, along with several other events that happen next week with our award ceremony, and then culminating with graduation. And then what I put down for myself is, and our team as our next goal is on June 11th, we'll do a similar presentation where I get on and talk about our progress, maybe bring on some members of our steering committee. Not quite sure, how that's going to look at this time, but certainly in the interest of transparency and updating you on our work, we want to make sure that you have the information, the most up-to-date information in an appropriate time possible. So holding ourselves to that June 11th next communication at least from the head of school, me, and then maybe others as needed or desired as well. So with that, we were shooting for about an hour, so sorry I went about 6 minutes over, 7:36, but I'll stay on as a little bit longer to answer your questions, but also want to be sensitive to your time. Really appreciate that you joining us. Put your questions in the chat. I'll check that out in a minute. I wanted to end with Ted Mitchell, who's president of the American Council on Education. If you've seen some of the things they're putting out, opening isn't going to be an event. It's going to be a process. And I think it's that dimmer switch, right? We're going to continue to adjust and refine until hopefully we can turn it all the way up and beyond and stay on. Maybe in a new normal with different practices in place, but we'll be sharing, with you what that means, and hopefully as we progress, we'll have a plan sooner rather than later that will outline the pieces of that, what it means for each department, and how we're approaching the school year. So with that, I will take a look at, we're up to almost 200 participants. That's great. The chat, hang on one second. Let me take a look at that. All right, so we get this. We get not related to Bring the Penguins Home Task Force, but certainly I will answer it. In terms of students picking up their belongings, so students can pick up. We get this question quite a bit, and we've been following, as I said, local, state, federal guidelines, and are hinging to or adhering to the May 25th date, which is Memorial Day. So we'll do Tuesday. Our student affairs office has communicated a sign up process for that. Josh Doyon is definitely the go-to person for that, but I will be sure that we get you that information, or if you want to reach out to him, let me know, but we do have who you are in the chat and can get that to you. Thank you. International students. Yeah, international students. We actually have I have a call next week with some immigration officials. It's different country by country. We know that. Many of our students have visa appointments and are able to maintain those. Some others, it's a slower process. Some are able to travel right now, some are not. We know this is going to change week by week. And so we will continue to be updated. I don't have a lot of information on that, but if you do hear, we'd love to hear from you. Anything that, if you're a new student and you are having difficulty, or if you just have questions about the process, certainly our admissions office will be happy to answer those questions as well. I also didn't mention we have our school council on our steering committee as well, who's connected us with an immigration specialist who's an attorney, and they can also help us navigate some of these processes if we need to. Next question. Are we able to increase air filtration protection on your HVAC system? Good question, and it's under our list for facilities, looking at ventilation, airflow, what that looks like, what filtration looks like. I don't have an answer yet, but we on campus have a director of engineering and master planning who's on the task force as well, along with our experts, and we're going to look at what colleges and universities are doing, what the guideline is, what other boarding schools are doing, and come up with the best, similar to some of these others, the best answer is for Cushing. We are fortunate that overwhelming majority of our systems, especially in our new building, are state of the art and new. So that certainly helps, but absolutely is an area that we're looking at. Any word on fall athletics? We do not have any word. I know our director of athletics was in a meeting just yesterday on that, and a lot of ideas being tossed around, but really we're waiting for guidance. Independent schools, especially boarding schools, tend to follow NCAA guidelines. Doesn't mean we have to. So we want to, again, be open in the most in the way that we normally are. And if that dimmer switch can be all the way up, that's great. If we need to dial it back in some ways, whether athletics look different or whatever that means, we'll need to do that. But I don't have an answer for that now. But as we continue to communicate, I may. So stay tuned. If need be, could students live in singles? So we have a number of singles on campus, and so we'll look at the best way to utilize those student by student. It's something we're talking about with our medical experts right now in terms of, are the roommates considered a family unit? What is the screening and testing looking like there, dorm by dorm? Do we live in cohorts where those students kind of tend to be around each other anyway throughout their classes and maybe activities? So we're trying to approach it creatively, again, to create the best experience possible. So absolutely something we're thinking about. What happens if a student gets sick? So again, looking at, you've probably heard universities talk about the 3 T's: testing, tracing, treatment. And again, we're implementing that, but also I think in a more comprehensive way where we know that students will have to have quarantine, separation, isolation protocols, contact tracing. It's encouraging. I just read a report done on Monday that was updated with resources about how this has impacted students under the age of 20. And some of the experts on our group are, you've heard some of the Kawasaki-like disease similarities. And really the numbers are very rare, quite rare. As of Monday, the report had very few deaths, it's like 10 from COVID in students under 19. And while that's very serious, the point that the author was making in relation to boarding schools was that we need to safeguard our entire community, right? It's going to impact adults. It's going to impact all of our staff, everyone who's here on campus. And so the focus is absolutely students and maintaining a healthy community, but also making sure that we have protocols in place for staffing and what that means. But again, we have the hospital about 10 minutes away. We will absolutely be focused on quarantine protocols, isolation protocols, what treatment looks like, and all the steps that need to happen along the way to do that. So taking that very seriously as well. Next question. Are we looking at the same starting date as of now? As of now, we are. If we need to adjust that in one way or another, we will certainly let you know in a timely manner. I would just ask that everyone allows us to be flexible, right? Could be earlier, could be later. If we find it advantageous to adjust the academic year schedule, we want to do that to preserve as much of the experience that students have here as possible, which includes academics, sports, everything else. So, just try to be flexible with us, and we will communicate that as early as we can. Next question. A couple of repeats, international sports schedules. Sports schedules are being set up as normally. Somebody asked, are sports schedules being set up as they normally would be? The answer to that is yes. Our athletic department is absolutely going through that process, scheduling the year next year as normal. And if we need to adjust, I mean, every school is in the same situation. So we all know that we're going to have to be flexible again with each other. But again, part of that work is absolutely setting up the framework for the year and then adjusting as needed. There's a lot of positive ones here. I feel weird reading those, but thanks so much for Cushing staff for work with remote learning. I'll certainly pass that on to the academic office. High level of communicating and planning, and general thoughts of the well-being of students. You're welcome. Happy to do so. Thanks for planning ahead. You're welcome. How do we ensure that hygiene is improved without being punitive to students? That's a great question. We're talking about training, not only for our adult population, of course, but with students. How do we make sure that students do have best practices when it comes to hand washing, hand sanitizer, and every other type of mitigation that we want, whether it's laundry, cleaning of their own rooms, their own personal space, and then maintaining social distance and following de-identification guidelines. And certainly we know that is a challenge and something that our entire community is going to have to buy into. But we also feel that the Cushing community is definitely capable of that. And as I spoke about before, when you talk about a comparison to universities, we'll definitely need to adjust. We may need to put people in various places where they normally wouldn't be to ensure that those things happen. And we're working through that process. So, certainly we don't want it to be a punitive process. Absolutely not. I think, for our returning families know that, that's not our philosophy, certainly not mine and our student affairs office, but also want to make sure that it's something we can enforce. And so there's a balance there, and we want to make sure that we do our best to implement whatever the task force comes up with. Few other sport questions. Airplane tickets. I would hold off. As I said before, I'm not quite sure. We're planning on our regular opening. How that's dictated earlier, later by state, local, federal authorities. I would hold off for now. Our plan is to be open, and hopefully it's when we can, but if it's advantageous to do it at a different time and be creative about our school year while maintaining our other programs, then we will absolutely do that. So I would say stay in touch. Certainly June 11th is the next, that's one of the reasons we want to do these communications pretty regularly, so that you're updated. And if you have questions, absolutely reach out to our admissions office, or you can reach out to me. This is for international students and the uncertainty for travel. Will there be some flexibility for remote learning? Absolutely. We're planning on various scenarios, which includes that one. If we have some international students, depending on the country they're from, where they're still in a travel ban or are not able to return, we want to make sure that you can start the year and join your classes seamlessly. That'll be part of the work of our academic subgroup, and certainly is a challenge, especially as they just close out the year. but we know that it's on your minds already, and then that you want answers to that. And so we'll be working hard to get you those. Some questions about cleaning process that'll be developed through the work of this committee. Again, I wanted to give the framework of how we're approaching this, and can get you details as we move forward. How will single rooms be distributed? So normally our singles are distributed um, by grade. We're certainly going to have to look at students who maybe are at risk or need them for various health reasons, or if they have another condition which would warrant them to be a little bit more separated in this case. So that is again part of our thinking, an initial thought. There could be other ways that we give out singles, but again, certainly on a long list of areas that we're looking at to address as we approach the opening. A lot of repeat questions. If students can't get their visas in time, similar, similar question where you don't need a visa to join our remote learning program if that's a need. Folks that I've spoken with at different consulates are optimistic, but again, time will tell. But we're willing to be flexible in our plan again and adjust to allow you to join your classes whenever you are able to come to campus. When will the calendar be released for next semester? So currently the calendar is on our admissions and academic pages for our newly enrolled and for our current families. So you can go in there and see those. We can get that to you as well, because I see you asked the question. Now, if there's an adjustment to that, we will certainly share that as soon as we can. Our hope is to open on time, and that's our goal. But if we need to pivot and have another plan that is safer for our community and our students, we will do so and communicate that to you as soon as it's made official. Somebody asked if there was a second wave, is quarantining the whole campus an option? That's kind of, I wouldn't word it that way maybe, but that's what we're talking about, where maintaining a healthy campus, and that we don't have a lot of coming and going from our campus in terms of our students and our faculty, which is why I think we're in an advantageous position when it comes to being here. With most of our folks living here on campus from the faculty, overwhelming majority of our students. And then, we can also continue to have people work from home as needed. There are many jobs in our business office and in other offices, our development and alumni relations office, who can work remotely, and then either, dial that back or increase the number of people working remotely as needed who aren't interacting with students on a daily basis. So again, all part of our thinking and part of what we're looking at. Just talk about virtual learning, a few questions about that. A few athletic questions, we spoke about that. Are there specific steps students and parents need to take to support the task force to get the Penguins home? This is a new parent. Anything we can do? I would say let's keep in communication. We can also talk after this if you'd like, this week or next, if there's anything specific you have in mind. But I'd love to be in communication with all of our new families to see, get your perspective, what you're thinking, and answer any individual questions you have about supporting this effort. Absolutely. Some visa questions, which we already spoke about. Somebody asked the question, any consideration of closing from Thanksgiving to New Year's? I would say everything's on the table. I'm going to do this next week with our employees, which is going to be a lot more detailed to talk about some of those kinds of things and give more specifics. And then maybe as this process goes on, communicate some of those specifics out as those decisions are made. But yeah, I think we need to, again, plan for that flexibility in every area. Are we taking into account parents in contact during drop-off? Yeah, that's been another part of our conversation, looking at the whole arrival scenario, what that would look like, pre-screening, testing. We've been following the Camping Association pretty closely. They just actually released and did a webinar that we sat in on with a whole host of guidelines, including mailing every family test kits at home, where everyone could be tested mailed back in, monitoring of signs and symptoms for a certain period of time, coming back. So all of those examples, again, that's another perspective that I forgot to mention earlier. Similar to Australian boarding schools going back to school and what they're doing in other schools around the world, summer camps and New England's these are big camp states, New Hampshire, Maine, Massachusetts, Vermont, and what they're doing. There's a camp in Pennsylvania that one of our senior team members has a family member, and they have testing coming out for being mailed in, coming back, and so who knows, that could be part of it as well. But I don't have that information yet. But it's an example of what we're seeing, and maybe by July, there's a better method that we haven't seen yet. So here's a good one. Given that we can't predict the future and that there are dozens of potential scenarios, what are the key strategic principles that will guide your decision making? Our key principles or guidelines for decision making have to be local, state, and federal guidelines. And as I said at the beginning, we want to exceed the minimum requirements of those. The other one is having a safe and healthy campus. We want to be sure that we can come back in a way that's prudent, in a way that is safe and healthy, not only for our students on campus, but as I mentioned, also our adult community. Also, there are families that live on campus, a number of other conditions, right, that somebody may be at risk or not, that certainly would never be in the public, but things that have to be considered in this group in confidentiality as we work to do this. And you're right, there are a number of scenarios and probably some that we don't even know exist. And so ultimately, that's why we use the example of the dimmer switch, and that we have to be supremely flexible in everything that we're doing. When we look at personnel, at finance, business continuity, security, admission to campus, visitor vendor policies, how the school store works, how mail works, student arrival, departure, the whole coming to campus, going to campus, coming back again, PPE requirements, laundry, how does that work? So many different areas to consider. And you're right, so many different scenarios to look at. I saw today as I was looking at another plan for a university, the graphic of the sort of like a funnel, right? And we have all these big circle of what can happen. We need to plan for that, and maybe the probable outcomes are sort of the next one, and the one we hope for is the smallest one, which probably won't get there. But we need to be planning for all of them as much as possible, which is why we wanted the perspective of other folks, not only from our internal team, but externally at various universities, boarding schools, and organizations to key into this and to come up with ideas. So that's the best answer I have for now. And it may be more specific as time goes on. Will class size change? It may, depending on what the guidelines are. Our classes are pretty small to begin with, and certainly some of our classrooms are much bigger than the others. So there may be guidelines about square footage per student per classroom. And if that happens, then we'll have to do an analysis of size of classroom and where students are, and it might be different from what we usually do. That again goes right back to that flexibility for everyone, not just students, right? They're going to classrooms similarly, but faculty, that'll mean different things for them, but it may not. Again, planning for all different outcomes. A few repeat questions here. Will it be mandatory to wear masks on campus? Maybe. Again, we don't know. It'll probably depend on how long students have come to campus. Maybe it's mandatory at first. Maybe as time goes on and there's an improvement in public health, maybe it's only mandatory in certain situations, and then after a while, it's not. It's sort of like that dimmer switch, right? We start with the maximum level of PPE protection, perhaps, and then dial it up as we go. Going to get input from various medical professionals, public health, Department of Health, Department of Education, public health, and our medical team to answer that. But it is an area of consideration, absolutely. Question about testing, will it possibly be required? I would say possibly. Again, we don't know, and there could be developments in how that happens. Our medical team is certainly in touch, and we have clinicians who are in practice dealing with that on a day-to-day basis. And literally our task force updates the last few weeks have, even in that realm especially, have changed to the positive, I think, for us in terms of looking to the fall. few questions on immigration, which we answered. Bookstore is open. Will the bookstore be open in the fall for online orders? I would say that's another, I actually spoke about school store as an example before, another area for consideration if we're saying one of those dedensification degrees or degrees of dedensification. If we're saying there are some who can work remotely and not, that could be an area that we say, we don't want several people in one area. That could be an area that's shut down and only done online. Again, definitely a consideration. Not a specific answer yet. AP tests. So as you may know, the AP tests were all done remotely this year from home. The AP usually is about a 2-hour test depending on the subject, give or take a few minutes. And this year was done in a 45-minute test online at home. I haven't heard, certainly they demonstrated a capability to do that and maybe could continue if that's necessary. Hopefully next spring we're in a very different situation and AP tests can continue as they did before. Restrooms, a high area of focus for our group. Any high touch area really is a place we're looking at. Enhanced cleaning, regular cleaning, monitoring even. So again, plans are in place for looking at how we will handle that. Don't have the definite ones yet. I'll answer this one again because it's coming up a few times, but if international students, for whatever reason, depending on the country they're coming from, either didn't get a visa or have a visa appointment late, say school starts, like it normally would in early September, and your visa appointment's September 20th, and you can't come until October 1st. What does that mean? Are you worried? You don't want to lose the academic experience. You want to be able to slide into your classes. So that's an area of examination for one of our subgroups that will be tackling how we can maintain or start that experience and ensure that you were able to slide in without missing anything as you go. Again, we are focused on that area, but at this time, at this beginning stage, don't have a definite answer and also don't know the immigration part. But going back to those various scenarios, because there's so many, we want to make sure that we have a broad enough focus to plan for all of them. It's a thank you. Thank you so much. Impressed with everyone's hard work. You're welcome. Dedication and how the Cushing community has embraced students while continuing to engage in a meaningful learning during this unprecedented time. We have a great team. I will say, when our academic office led the way for remote learning, it was really impressive to watch. Rajabala, Dr. Jennifer Willis, lots of heavy lifting there. Dave Stone came together and put together a program that everyone here is really proud of. Our teachers have been working around the clock with our students and also our other employees working from home, getting the job done. It's been great to be part of that team, and which gives me great confidence in knowing that we can execute on the goals of opening in the fall and looking at how we will do that and planning for the various scenarios. A couple of thank yous. And I want to make sure we honor your time. Oh, it's 8:02. Well, certainly if you have additional questions, there are some in the chat. They went pretty quick, but I did get to the end. We do have a log of that. We will reach out to you individually. Please don't hesitate to email me individually anytime, day or night. I'll get back to you. Our international parents, I know, as I said at the beginning, if you got on late, WhatsApp, WeChat, we're probably connected there. Many of you have my cell. Want to make sure that communication is being maintained and you're not wondering what's happening, but that you have the answers that you need and know what we're planning on the fall for your student. I hope everyone has a great night. Really appreciate, again, the time that you've taken, and also appreciate that you've chosen Cushing as a returning student, but also as a new student. And we look forward to bringing the Penguins home back here to Ashburnham and maintaining a healthy and safe community. So thank you for all your time tonight, and appreciate you being a part of our Cushing family.